I think I was talking on mute. But Dr. Modha told me કે ભાઈ તમે મ્યુટ ઉપર વાત કરો છો. Hi. Anyway, this is live program. So, hello, Bay Area. You are listening to Radio Mirchi 1310 AM, and this is your RJ Mirchita. And today is a very, very special doctor with us. પણ આઈ વોન્ટ ટુ ગીવ વેરી વેરી સ્પેશિયલ ગ્રીટિંગ્સ, કારણ કે વર્લ્ડના કાલે જ હું જોતી હતી કે કેટલા કોન્ટિનેન્ટ્સ છે, કેટલા સ્ટેટ્સ છે, પછી બધા કન્ટ્રીઝમાં કેટલા સિટીઝ છે, ડિસ્ટ્રિક્ટ્સ છે, કાઉન્ટીઝ છે, and I was literally baffled to just know કે એવરી કન્ટ્રી આ વર્લ્ડમાં કોવિડ મેનેજમેન્ટ કઈ રીતે કરે છે, અલગ અલગ રીતે, એવરી સિટી અલગ રીતે. સીડીસી આમાં ગાઈડલાઇન્સ આપે તો કઈ રીતે, કેમ લખે, કેવી રીતે કે હરેક કલ્ચર, હરેક રિલિજન. ઓ માય ગુડનેસ, ઇટ્સ અ બિગ રિસ્પોન્સિબિલિટી. આપણે આમ સ્ટેટમેન્ટ આપી દઈએ કે હવે આ સીડીસી વાળા તો બોલ્યા રાખે, પણ તમને ખબર છે કે એ પોઝિશન પર બેસીને એક સ્ટેટમેન્ટ લખવું એટલે આમ આપણા ઉપર કેટલી જવાબદારી હોય. પણ આજે આપણી સાથે એવા જ એક ડૉક્ટર છે જેમણે આખું એમનું કરિયર, એટલી બધી રિસ્પોન્સિબિલિટીઝ, અને ઇવન ગોકુલ સાથે પણ એ એટલા સારી રીતે એસોસિએટ છે કે જો આપણી સાથે ડૉક્ટર ડી.કે. શાહ ના હોત ઓર એમણે હેલ્પ ના કરી હોત તો કદાચ ગોકુલ હોસ્પિટલ આટલી સરસ ના હોત, રાઈટ? અને આપણે પૂછશું ડૉક્ટર મોઢાને કે કઈ સ્ટોરી છે, એટલે એ ઇન્ટ્રોડક્શનમાં આપણે કહેશે થોડુંક. પણ જસ્ટ આઈ એમ ટોકિંગ મોર અબાઉટ રિસ્પોન્સિબિલિટી. એક જેને કહીએ ને, બહુ મોટી વસ્તુ છે. લીડરશિપ પણ એક બહુ જ આમ મોટી વસ્તુ છે, અને હરેક માણસમાં એટલી કેપેસિટી ઓર સ્કિલ સેટ ના હોય કે એ જવાબદારી સંભાળી શકે. ફોર એક્ઝામ્પલ, અશોક રાજા હતા, રાઈટ? તો એમની જવાબદારી તમે લ્યો, એમના દાદા, પરદાદા, પછી તમને કોઈ યાદ છે? મને કોઈ યાદ નથી કે આફ્ટર અશોક રાજા કોણ આવ્યું છે. નો, આઈ ડોન્ટ નો એનીબડી. એટલે લીડરશિપ અને આ અમુક વસ્તુ છે ને, એ હેરિડિટરી હોય, પણ આપણામાં એવી જુસ્સો, એન્થુઝિયાઝમ હોવું જોઈએ, રાઈટ? અને ઇટ્સ હાર્ડ, ઇટ્સ નોટ ઇઝી. બોલવું સહેલું છે, પણ હું લોકોને એમ કહું છું કે કરી દેખાડો ને તો તમે સાચા. તો આજે એવા ડૉક્ટર છે જેમણે બોલ્યું નથી, જેમણે બધું જ કરી દેખાડેલું છે, અને હજી પણ એટલી જ સારી રીતે બહુ જ સરસ જવાબદારી એમણે લીધી છે આ કોવિડ મેનેજમેન્ટની. તો એ આપણે આજે વાત કરીશું. બટ ટુડે વી હેવ અ વેરી સ્પેશિયલ ડૉક્ટર વિથ અસ, અને એમનું નામ છે ડી.કે. શાહ. એટલે વી હેવ, મને બહુ ક્યુરિયોસિટી હતી કે આપણે એમને ઓળખીએ છીએ ડૉક્ટર ડી.કે. શાહ તરીકે, પણ એમનું ફૂલ નેમ શું છે? એટલે હું એમ કહીશ કે આપણી સાથે છે ડૉક્ટર ધીરજલાલ કાંતિલાલ શાહ. દેટ ઇઝ આર મોસ્ટ ફેમસ ડૉક્ટર ઓફ રાજકોટ, અને બહુ જ ફેમસ ઓર્થોપેડિક સર્જન છે રાજકોટમાં, અને અલોંગ વિથ અવર ડૉક્ટર મોઢા. તો આઈ થિંક દેર ઇઝ અ લિટલ બિટ ઓફ ઇન્ટ્રોડક્શન, કારણ કે આમ તો ઇન્ટ્રોડ્યુસ કરવા બેસું ને તો આપણે ડૉક્ટર શાહ ઉપર પણ 2-3 બુક્સ અથવા બધું ઘણું બધું લખી શકીએ એમ છે. પણ હું થોડા શબ્દોમાં મને જે રીતે સમજાય છે એ હું કહીશ. એમનું ઇન્ટ્રોડક્શન, વિચ ઇઝ Dr. D.K. Shah graduated with MBBS from Saurashtra University in the year 1972. He completed his MS in orthopedic surgery from Mumbai University and followed by FCPES Ortho from College of P&S, I think from Mumbai University, and again he did diploma in ortho from the same in the year 1975. એટલે તમે વિચાર કરો કે આપણી સાથે એટલા સિનિયર ડૉક્ટર આજે છે કે હાઉ ડુ આઈ ઇવન ઇન્ટ્રોડ્યુસ, રાઈટ? હું બહુ નાની પડું છું, રાઈટ, ઇન્ટ્રોડ્યુસ એમને કરવા માટે. બટ રાઈટ નાઉ હી ઇઝ અ ડિરેક્ટર ઓફ પીજી ઇન્સ્ટિટ્યૂટ ઓર્થોપેડિક હોસ્પિટલ, એન્ડ મોસ્ટ ઇમ્પોર્ટન્ટલી એ છે ચેરમેન ઓફ એથિક્સ કમિટી એટ ગવર્મેન્ટ પીડીયુ મેડિકલ કોલેજ રાજકોટ. He has been past president of Gujarat Orthopedic Association, founder president of Rajkot Orthopedic Association and member of academic MS, president of Gujarat Buddha Co-op Society, former dean medical faculty at Saurashtra University. He is currently working as an honorary orthopedic surgeon at GT Sheth Orthopedic Hospital Rajkot from last 20 years, and also Apang બાલ ગૃહ, એક આઈ થિંક એક સંસ્થા છે રાજકોટમાં, સ્ટેટ ગવર્મેન્ટ ઇન્સ્ટિટ્યૂટ છે. તો એમાં પણ હી હેઝ બીન એસોસિએટેડ, એન્ડ ઓલ્સો હી હેઝ બીન એસોસિએટેડ વિથ ડિપાર્ટમેન્ટ ઓફ સોશિયલ એન્ડ વેલફેર. He has been a medical referee for New India Assurance Company Limited, the Oriental Insurance Company Limited, National Insurance Company Limited, and he's also a panel orthosurgeon for National Airport Authority as well. He is founder of Dr. Shah's Orthopedic Hospital and very well known orthopedic surgeon of રાજકોટ. તો આપણે જેમ કહીએ ને કે ભાઈ આપણી સાથે એક બહુ જ એક્સપિરિયન્સ્ડ જૂના અને જાણીતા ડૉક્ટર છે, હું એમ કહીશ આજે. એન્ડ નાઉ ઇટ્સ ટાઈમ ટુ વેલકમ ડૉક્ટર ડી.કે. શાહ એન્ડ ડૉક્ટર મોઢા. એન્ડ ડૉક્ટર મોઢાનું ઇન્ટ્રોડક્શન તો હું શું આપું, બે જ લાઇનમાં એમ કહીશ કે ભાઈ ફાઉન્ડર ઓફ ગોકુલ ગ્રુપ ઓફ હોસ્પિટલ્સ, વિશ્વપિતામાં ઓફ સર્જરી અને સર્જનોના સર્જન. પણ મને ક્યારેક એમ ક્વેશ્ચન થાય કે ડૉક્ટર મોઢાને પણ કોઈએ ટ્રેનિંગ આપી હશે નહીં? ડૉક્ટર મોઢાને પણ આ લેવલ પર પહોંચાડવા માટે કોઈનો તો હાથ હશે, રાઈટ? એમને પણ આમ પુશ કર્યા હશે જ્યારે એ રેસિડેન્સી કરતા હતા ઓર ભણતા હતા. તો આજે આપણે એમને પૂછીએ કે કોવિડ સ્ટેટિસ્ટિક્સ તો એ આપણને કહે પહેલાં, પણ પછી આપણે એમને આ બધા સરસ ક્વેશ્ચન પૂછ્યા ઇન્ટ્રોડક્શનમાં ડૉક્ટર ડી.કે. શાહના કે ભાઈ એ જરાક અમને સ્ટોરી જણાવો. તો નાવ આઈ વુડ ઇન્વાઇટ ડૉક્ટર મોઢા કે આવે સ્ટેજ પર અને સ્ટેટિસ્ટિક્સ શેર કરે, એટલે કે વર્લ્ડના, ઇન્ડિયાના, રાજકોટ મ્યુકરમાઇકોસિસ વેક્સિન. તો વેલકમ ડૉક્ટર મોઢા એન્ડ વેલકમ ડૉક્ટર ડી.કે. શાહ.
Welcome, my boss, Dr. D.K.Shah from Rajkot. He's the senior most orthopedic surgeon, and we love him too much. Then, having said that, I'll talk about Dr. D.K.Shah little bit later. But
Yes.
how good man he is, so that I will narrate. But before we go for that, I will say the statistics of the corona of the world. So let us begin with USA. USA is facing very bad situation. The corona cases, new cases are 1,62,724 and death is 1,128. Coming to UK, it is 33,646 and deaths are 111. Now coming to India, we have got 36,401 new cases and 513 new deaths. Going to Brazil, it is again 41,714 new cases and 1,064 deaths. Now Australia, it's not now remain my favorite country, because Australia is worsening, is 658 new cases and 3 deaths. So, but New Zealand, there are no new cases, no new deaths. So New Zealand now I'm shifting to, New Zealand is shifting in my book as a good country. Now coming to Gujarat, it's 23 new cases and 1 new death in Gujarat. Jamnagar and Junagadh has got no new cases, zero new cases.
Wow.
That is the thing to be celebrated. Ahmedabad has got 4 new cases. Surat has got 2 new cases. Baroda has got 9 new cases. And Rajkot and Bhavnagar has got 1 new cases each. So these are the statistics. Then we go for vaccination. Today is a great day. One thing is Dr. D.K.Shah came to our show. The second thing, the health minister from the government of India, Mr. Mansukh Mandavia, has visited Rajkot and we have welcomed him. And he said that we have vaccinated 56 crores of the people of India. First dose. It is first dose, but figure is 56 crores. So that is a great thing. And with this remark, I think should I say something about Dr. D.K.Shah?
Yes.
So,
ડોક્ટર મોઢા, થેન્ક યુ સો મચ ફોર સ્ટેટિસ્ટિક્સ. પણ પહેલા મને એ કહો કે તમે પણ એક દિવસ રેસિડેન્ટ હતા, તમને પણ કોઈએ હેલ્પ કરી હશે, એ કોણ છે અને એની સ્ટોરી કયો.
એની સ્ટોરી કહું તો ને,
હા,
ડોક્ટર See, I was struggle a lot. I have struggled a lot in my residency
Mm-hmm.
because I didn't get admission at Jamnagar in MS General Surgery. So I went to Mumbai. I was a houseman in Harkishan Das Hospital in general surgery as well as in the neurosurgery department. So there, uh, I met Dr. Bansali. I was a houseman of Dr. S.K. Bansali, Sirish Bansali, who operated on Amitabh Bachchan. You know, the Kulli picture, Amitabh got injury,
Yes.
then he did tracheostomy of Amitabh Bachchan.
Oh.
So at that time I was his houseman
Mm-hmm.
and I used to assist him.
Hmm.
But I could not get, they could not help me to get the admission in MS in general surgery in Mumbai.
Hmm.
So Dr. B.J. Damani, who is a great teacher and is from Rajkot,
Hmm.
he took me to Sai Hospital.
Hmm.
There he gave me registration in neurosurgery direct 5 years course. તે માણસના નસીબ હોય એવા
Huh.
મને એક વર્ષ એડમિશન મળ્યું જ નહીં. I
Huh.
was just working as a resident
Hmm.
without registration in neurosurgery.
Hmm.
So a day came, suddenly all of a sudden there was a 5 years course in neurosurgery was announced by the Bombay University.
Huh.
And all the admissions is over. So I was the only applicant. So I applied and I got it. So this is the luck.
Excellent. Luck. Yes.
Then I used to work very hard because we don't know, there were no relatives of mine in Mumbai.
Hmm.
And those who were there, they were staying very far away. So I could not go to them. So I used to stay in the hospital 24 hours. And then Dr. P.S. Ramani, who helped me a lot, he held my hand, he made me do surgery, helped me to get acquainted in the privates. So he is my real teacher, is
Hmm.
Professor Ramani.
Hmm.
So
Hmm.
Dr. Damani took me to Sayan Hospital, but surgery was taught to me by Professor Ramani.
Hmm. Hmm.
Actually both, but Ramani gave me most of work. So that is my story. He used to take me to his home because I didn't have any holiday. 24 by 7 by 365 days. So that was tough residency which I had in Mumbai. I used to sleep on the bench in the casualty department.
Oh.
So that's the things. After passing my neurosurgery, Professor Ramani sent me to Newcastle upon Tyne as I was Bombay University first. After doing that, coming back, I came to Rajkot and then Dr. D.K.Shah came in picture. You see,
Yes. Yes.
so once I
I
came to
tell you,
Rajkot,
Hmm.
please carry on.
Yes. Yes,
Sir,
Dr.
please.
Shah.
Naini, in additions to something which Dr. Modha is telling,
Yeah.
though he is training, because see, Mumbai is one place. Mumbai, where I also got my post graduation degree and whatnot. Mumbai is one place they make the person to work like a donkey. I'm
Yeah,
sure Buddha must have worked for day and night like me.
yeah,
I also did in KM, and KM it was there was a havoc. You have to go at 7 o'clock in the morning, and you have to midnight 12 o'clock. You have to come back. You have no lunch time. You have nothing. Only a packet of Parley biscuits which we carry in our pocket, and we have lunch. That's all. And we were so young that we were so hungry. But then Dr. Pandey, Sharad Pandey, Chunky Pandey's father,
yeah,
was our assistant professor, and he was a very smart guy and fired like anything. He used to have a lot of discipline, and the people who are trained in Mumbai are little different from the people who are trained in other places, because Mumbai is one of the places where all over India, all the drainage from patients from all over India come to Mumbai. and we have to get exposed to so many different types of diseases.
Yes.
So Dr. Modha, when came to Rajkot, I'll tell you, he was totally looking for a place to settle down, because he was just having a to get operated. Suppose I call at my hospital, he'll come and operate me. At calling somewhere else, he go and get and operated there. But he was looking for a place, and one place we found it for him, and we thought that this is the place which Dr. Modha will grow. And me and Dr. Pankaj Patel, the another guy, orthopedic surgeon, who is in Surat at present. Also, we have just asked him that you should get this place done. Otherwise, if you don't buy it, we will buy it. But that he was promoting, and fortunately he has come up like anything. So I'm happy that I'm one of the base person to in the growth of Gokul Hospital. So now
Yes.
the Gokul Hospital is now one of the best corporate hospital in this region, and everybody praise it. And every type of surgery, every type of treatments are done in Gokul Hospital,
Yeah.
including in COVID time. They have done excellent job. There are so many ICUs people were working, and they have done an excellent job. Excellent job. I congratulate them. Thank you.
But it's thanks to you. Thanks to you. You know, Ishita, I'll tell you
Yes.
the little more story behind Dr. D.K.Shah. This hospital where I am sitting now was of Dr. Dangaria's hospital.
Yeah, that
Okay.
was
He is
Dr.
my
Dangari.
classmate.
Okay.
So initially,
Yeah, he has gone to
uh,
Middle East. At present, he is
yeah,
in
now
Dubai.
now at the
I
moment he
think
is in
Dangari is
Ahmedabad.
in Dubai.
Yeah, he went to Sharjah, but then again due to COVID he is in India. He may go back.
Yeah.
But I talked to him and he says 21 lakhs. I didn't have that money, but still
Oh,
I did it. And I thought I
Yeah,
will
it
raise the
was
money from my friend circle, but I could not do it. And I gave him 5,000 rupees as a token. I could not raise the money. મેં કીધું ભાઈ આપણાથી પૈસા નથી ત્યાં દીકરા. It's તું
no,
રાખ
it
મારા
was a
પાસે
huge
રૂપિયા.
risk.
Yeah.
Yeah.
એટલે પછી તો એને એવો ઓલું થઈ ગયો આપણા પ્રત્યે કે આ ગદરા ખોટાડ્યા છે અને you don't have money and you come for purchasing the hospital.
was.
So they were not trusting me. In reality, they were not trusting me. So the hospital could not solve and it was lying as it is. So DKShah and Dr. Pankaj Patel and one of my another friend is Bharat Desai, who is in USA now. He is in New York. He is now at the moment, DK Bharat is here in
Yes, yes, yes.
Rajkot.
I met him. I met him.
Yeah.
I met
So
him.
these three people helped me like anything. Then she was not trust the wife of Dr. Dangaria.
Huh.
She was not trusting and she was in distress to sell the hospital. So she started selling the instruments which were there in this hospital.
Oh.
Uh, because they were also having a financial problem. So she want to cover and reduce the financial debt. But then she, one day she telephoned me that your 5,000 rupees is lying with us. So if you are interested in this hospital, so I talked to DK Shah, Pankaj Patel. DK આમ છે આપણે મેં કીધું અમારે 15 લાખમાં લેવી. મારી પાસે હવે કઈ છે નહીં પૈસા. અને આમે મને ખબર હતી મને નહીં દે. એટલે આ બધા મોટા સાહેબ ભેગા રાખ્યા. આપણો કોઈ વિશ્વાસ કરે નહીં. એમાં પોરબંદરનું એ સમયે નામ was very bad. પોરબંદર વાળા કે એટલે આઘા માણસો ભાગી જાય.
I think Santok Ben was there, right? Santok Ben.
એટલે because of that કોઈ પોરબંદર વાળાને ઘર ન દે ભાડે કોઈ બીજું કઈ ન દે એવા સંજોગોમાં Dr. D.K.Shah, Dr. Pankaj Patel, and that Dr. Dangaria's wife. We and Bharat Desai. We met at Dr. Pankaj Patel's residence. And I said, I have got 50 lakhs. So DK said, પંકજ પટેલ કે 15 લાખ ઓછા પડે 16 લાખ કરી નાખ મેં કીધું લાવ અહીંયા પૈસાની કટોકટી છે તો કે હું કહું કરી નાખ તો ડીકે કે 16 નહીં 16.5 દઈ દે એટલે 16.5 માં આ હોસ્પિટલ નું નક્કી થયું આ બે બધા વચ્ચે રહ્યા પૈસા માગી તુડીને ભેગા કર્યા અને આ હોસ્પિટલ થઈ ગઈ પણ this was the story of starting of Gokul Hospital and these people are the instrumental
Yes.
to help me out a lot out of the way મારો એવો વિશ્વાસ કોણ કરે મારે કોઈ નહીં એવું બેકિંગ કોઈ નહીં કાંઈ નહીં આપણી પાસે એક સ્કિલ હતી ન્યુરોસર્જરીની બાકી there was nothing with me so in that circumstances these people has helped me અને એનું ઓબ્લિગેશન મારી જિંદગીમાં હું નહીં ભૂલું તો
Yeah.
થેન્ક્સ ટુ ડોક્ટર ડીકે શાહ
Yes.
આઈ એમ મચ ઓબ્લાઇઝ અને એના બધાના આશીર્વાદથી જ આપણે આ કરી ગયા
I know.
it's not beyond my capacity to do it but
he
આવા
deserves
બધા
it
દોસ્તારો
he deserves it because he has worked so hard and he was very good at his work. Neurosurgery especially. He's one of the best neurosurgeons available in this region. So I think he deserves it and he needs the 3 claps exactly. And I appreciate and I, I, I thank you that he has appreciated our efforts during those days. This is about not less than 30 years back or 25 years back.
yeah exactly
I hope
30 years
Sorry.
it is exactly 30 years
it is long back, but he remembers us very well. Right.
What a
આવું ભૂલાય
wonderful
થોડું
moment. What a wonderful moment on the show today. And that's why I wanted to make sure કે આપણે આ વાત કરીએ મને બી નહોતી ખબર આજે સારું થયું મેં ક્વેશ્ચન પૂછ્યો એટલે ખબર પડી કે કઈ કામ છે એટલે કયો બટ અમેઝિંગ તો આઈ એમ વેરી વેરી હેપી કે તમે તમારા ડ્રીમ્સને આમ શું કહેવાય સાકાર કર્યા છે તમારી નજરો સામે નોટ એવરીવન કેન ડુ ધેટ ઇટ્સ હાર્ડ એમાંય હોસ્પિટલ પેશન્ટ્સ પૈસા મેનેજમેન્ટ ઓ માય ગોડ એમાંય હવે તો કોવિડ એટલે શું કેવું બટ વી હેવ 2 હોસ્પિટલ્સ નાવ ઓફ ગોકુલ રાઈટ એક આપણી કુવાડવા એન્ડ ધીસ વન મોર ધ ઓરિજિનલ
one at Jamnagar
ઓ જામનગર ઓલ્સો યસ યસ બરાબર તો હવે આપણે ક્વેશ્ચન સ્ટાર્ટ કરીએ
yes
Sure.
yes
Excellent. So first question હું પૂછીશ Dr. Shahને which is should surgeon demand COVID CPR test report before admitting patient for surgery?
See, if it is not an emergency, suppose we can wait for a day or so for any surgery, because we have plenty of accidents on the roads and lot of emergencies used to come. So if it is not an open fracture, not bleeding, or not, we can just wait for about 24 hours before they are assessed for pre-surgical assessment. Then we do it RT-PCR very regularly. Otherwise, there is one test known as antigen, which is a very fast test which comes within 2 or 3 hours. And that antigen is easy to do it, and we ask the laboratory people to do it. But normally, whenever possible, when we can wait for some time, and in orthopedic, if the fracture is closed, if he is not in shock or something, we treat the shock first, and we treat the patient's local wounds and everything, and we can wait for 24 hours. But it is necessary that we should do it, because if we don't do it, we are about 5 to 7 people in the operation theater. There is anesthetist, there are 2, 3 assistants, there are one person who is operating the machines. They all get infected unnecessarily. They are exposed to, even though in spite of all the precautions we have taken with all the shield and all the proper dressings and everything is done, we are not totally secured and totally this thing from COVID. So we have to take care that we are dealing with the person who is not having any COVID infection. So we have to get it done if it is a not an absolute acute emergency. But in case of acute emergency, we can do the antigen test, which take about 2 to 3 hours. Yes.
All right, thank you, Dr. Shah. The next question, Chair, which is should surgeons suggest patient to get vaccinated and wait 10-15 days before proceeding with non-life threatening surgery?
I don't think that vaccination is the answer to uh, getting immunity to the doctors, because vaccination get immunity of the patient, and there is no point in waiting for vaccination. A vaccination is to be taken when a person is in a cold case, and it is not just a pre-operatively. Before the operation, I think there are two tests that are important. That is, one is RT-PCR and another is antigen test. These are the two, and another thing is clinical assessment of the patient. If the
Hmm.
patient is having within a severe pain, but not having any symptoms of any this thing, but even though antigen test has to be done before the surgery, and there is no need of vaccination is to be done after patient becomes all right or during the treatment also, if the vaccination program is going on. See, vaccination is a it's causing immunity to the patient so that next time he will not get it. It is a vaccination does not prevent doctors. If he is vaccinated, does not mean that doctors is not going to get infection. If he is having infected, he has to be treated, and we have to take care that we don't get infected with all the precautions of dressings and all the PPE kit and all the precautions, all the sterilizations and fumigations prior to the surgery.
All right, thank you. The next question is since there is no cure for COVID, I wish હું એમ કહી શકતી હોત કે ક્યોર થઈ ગયું છે કોવિડ પણ નથી. તો since there is no cure found for COVID yet, do you think that mask should be mandatory until the cure is found?
See, there is one sentence which is said in the medicine is prevention is always better than cure. So, for prevention, I am sure Dr. Prakash Modha also will agree that for prevention, mask and the social distance and not to be in the crowded place is the three important points which are to be taken care of. Because say if you are, because you don't have a treatment as such, we are treating the symptoms. If there is a fever, we give paracetamol. If there is a steroids, if you have got some lungs problem, you give some antibiotic, you go so many other things, but there is no anti-COVID treatment unless one is vaccinated. Then and then there he is prevented from the COVID itself. So it is something like that. I'll give you a small story for that. કે
Yes.
સપોઝ આ પર્સન શેઠ એક બેઠા છે, શેઠ સૂતા છે, રાતના કૂતરો પાડ્યો છે, રાતના 12 વાગે કૂતરો ભસે છે, ચોર આવે છે, એ ચોર ભાગી જાય છે અને કૂતરો ભસતો બંધ થઈ જાય છે, પણ ચોરની શેઠની ઊંઘ ઉડી જાય છે. બહાર જુએ તો there was no one, no ચોર, કૂતરો એમને ભસતો હોય છે. પાછા સુઈ જાય છે તો કલાક પછી ચોર પાછો આવે, કૂતરો પાછો ભસે, કૂતરો ભસે એટલે શેઠની ઊંઘ ઉડી જાય, એટલે બહાર આવીને જુએ તો ચોર નથી. એવી રીતે 3-4 વાર બને એટલે શેઠને ઇરિટેશન આવે કે આ કૂતરો ઘડીએ ઘડીએ ભસે છે, અહીંયા તો બહાર તો કોઈ નથી, એટલે કૂતરાને મારે છે. એટલે વી યુઝ ટુ વેરી ફ્રેન્કલી we used to treat the symptoms in a very good manner, giving lot of oxygen, giving lot of steroids, giving lot of antibiotics which is proper, and giving lot of care to the patients. And that is how we used to treat it. We don't have an anti-COVID treatment yet, but we used to treat the symptoms. એટલે આપણે અમે લોકો હજી સુધી કૂતરાને જરાક એકાદ લાકડી મારી દેતા એટલે બધું ઠીક થઈ જાત, પણ ચોર તો ને હજી સુધી ચોરને પકડી જ નથી શક્યા. Vaccination is the only answer. I'm sure Dr. Modha will agree that vaccination is the only answer to the problem. That if you are vaccinated, you are prevented your the spikes are there on coronavirus. If you see the photograph of coronavirus, there are spikes.
Yes.
If coronavirus comes through the nose or through any throat or anything, that spikes are broken or it been shaved off by the immunity which a person have developed after the vaccination. So vaccination is the only answer to prevention, and the another answer for surgeon to get prevented is to have a mask, have a protected shield, have a PPE kit, and during surgery and otherwise also. I think you won't believe, Mirchita, we have lost about more than 1,200 doctors because of COVID infection in our country. I'm sorry to say this because in spite of taking such care, we lost people. Prakash Modha will agree with it. And even in Rajkot, we have lost few people, and
Yeah.
we are very sorry for that. So prevention is always better than cure. The another, I am repeating the same sentence that in medicine, prevention is always better than cure, and that's why we have to wear the mask. We have to keep the social distance. We should not take it lightly. The third wave is going in USA.
Yes.
See, even if there are no cases here in Gujarat or there are hardly any cases in India, but even though we should be careful for about this, at least this year, this 2021. We don't know when that can arise, this Delta type of coronavirus that may give some problem. So I think
Mm-hmm.
prevention has to be done. Otherwise, we are absolutely exposed to the infection, and we should not take it lightly.
Right. Dr. Modha, comments?
Yeah, DK Saab is absolutely right. And I will say that without mask, today we had seen in the political meetings, so very few people were wearing the mask. But when we went to the auditorium, they have kept the safe distance and ask everybody to wear a mask, keep social distance, wash your hands, sanitize your hands. That was the thing which was going on.
Right.
So
That's true.
it is a very, very important thing. અને તમને ખ્યાલ હોય તો Mirchita, in Jain, previously they used to keep small pataka like things. That was also one sort of a preventing the spreading of infection or get to avoid infection for themselves. So all the things are very, very important and essential in our life nowadays because COVID will not go, it will stay, and we have to prepare ourselves to fight with the COVID.
So true. So next question આપણે લઈએ, which is a very interesting question. કે what is the guarantee for COVID eradication in case of mass herd immunity if it's achieved?
See, you are asking me, I hope.
Yeah, yeah, yeah.
Yeah, it is
You're
for
asking
you
me,
only.
is it?
Of course, of course.
Yeah.
Okay. See, I'll tell you, in human body, in my hospital, there is one sentence is written that માણસોની જિંદગીની guarantee અથવા તો કોઈ પણ ખાતરી માગવી નહીં. કારણ કે, you see, human body is made in world God. It is made by God. See, he is almighty and he has made this particular body and his all the machines. And we are the repairers only. We repair the body, but we are not the manufacturer. So manufacturer is God. So if God is manufacturing thing, even this machine, which AC machine is running behind me, is getting some problem and is made by the human being. The repairer will not guarantee it that will be as good as manufacturer. So how can a person, we are human beings basically, uh, because we are trained and we have been studying and we are working hard and something we have become doctor and that we have got some knowledge to repair the things. So, and nowadays the repairing also is to be done by the specialist. Suppose there is a neurosurgeon case, I cannot do anything. If there is a fracture, I can do anything, but Dr. Modha will do for neurosurgery or spine surgery or spine edema. But he cannot, or he or me or any doctor cannot guarantee 100% for any of the repairing, because comedy fitting, which God have made, the manufacturer, a person like medical people, they can help you in getting little better even after COVID. I'll tell you, after COVID, there are so many fibrosis of the lungs. There are so many breathing problems. A person who can climb 10 stairs could not climb 10 stairs after getting COVID because their lungs are damaged. So, in spite of giving the best of the treatment in the best of the hospitals, they cannot give 100% result. A 100% result is not fair to ask by the patient from the doctor, because they try their best. Why should they not try their best? Because they are paid for whatever they are doing. Even in the government hospital, even they are taking most utmost care. I'm telling you, I am attached to the government hospital also, this medical college, as an ethics committee chairman. I know people they are working day and night. The houseman, registrar, and everybody is working day and night. But even though they are 100% result, or you cannot save everybody's life, because it depends on the severity of the disease and the immunity which you have. The comorbidities, one person is having diabetes, blood pressure, and breathing problem, asthma. These people are getting little poor results than the person who is more healthy, more immunity, more immunized, doing a lot of exercises, breathing exercises, yogas.
Hmm.
They are having a long life. They are having a better results. And I'm sure Dr. Modha will agree with me that 100% guarantee in body or in human body, we cannot give it.
Yeah, absolutely correct. અને કહે છે ને કે ન જાણ્યું જાનકી નાથે સવારે શું થવાનું. તો ભગવાનને ખબર નહોતી કે ભાઈ કાલે શું થવાનું છે. તો હવે આપણે તો પામર મનુષ્ય છે, ડોક્ટર હાચા, પણ સ્ટીલ વી આર મનુષ્ય, અને વી કેનોટ ગીવ એનીબડીઝ ગેરંટી. તો ધેટ ઇઝ ધ સિચ્યુએશન. પણ અહીંયા બધાને માગવાની ટેવ એવું, ડાક્ટર બરોબર થઈ જાય છે ને હું 100% ને. અરે બાપા 100% મારું નકાઈ નથી. આમે ત્યાં ઉકલી જાય એ કહેવાય નહીં તો કેમ કહી શકું. એટલે this is the thing, whatever Dr. D.K. Shah says is absolutely right,
So
and
true.
we endorse it.
યસ, સો ટ્રુ. જે રીતે તમે સમજાવ્યું ને, એક બહુ જ સરસ આમ એક્ઝામ્પલ આપીને, આઈ થિંક બધા લોકોને સમજાવવું જોઈએ આ વસ્તુ, કે આપણે કોઈ પણ સર્જરી કરવા, આઈ નો કે ખબર છે કે ગેરંટી તો ડૉક્ટર ના, પણ તોય આપણે હું પણ હો કદાચ મારી સાથે, હું પણ ના સાહેબ તમે સાચું કહો ને, થઈ જશે ને સરખું થઈ જશે. So, ખબર નહીં કેમ એવી એક્સપેક્ટેશન બધાને હોય સાયકોલોજીકલી. આઈ થિંક ઇટ્સ અ થિંગ, રાઈટ?
અને અમુકને સાયકોલોજીકલ સપોર્ટની જરૂર હોય કે હા ભાઈ વાંધો નહીં આવે, જલસા કર, then they become all right.
I'll add one thing. I'll tell you, two patients having the same disease, the person having a positive thinking, psychologically very strong, gets all right within 3 weeks. The person who is psychological bhangai gaya and marai gaya, there was a survey in US. It has been done. There were two wards. One patient, one people who are believing in God, who are having a lot of faith in God and faith in the doctor. More faith in the doctor will cure you earlier. More unfaith in the doctor will keep little more longer time. And they have proved it scientifically in two wards. One ward, same type of patient, same cardiac problem, same age group, same type of treatment is going on. The people who are having a lot of faith in God and in the doctor have all right within very short time. The history is very clear about it. And this is a faith See, doctors and patient relations are absolutely in faith of the patients on the doctor and the responsibility of the doctor. More the responsibility is there if there is a lot of faith in there. I'll give you one small example if you can permit me.
Yes, yes, please.
See, I'll tell you, Sikandar. Sikandar was traveling through the northern side and near the Turkey and later on the northern side. There was a huge Sena with him, lot of people with him.
Hmm.
He had a stop one side, and there is a huge lake which was having a freezed lake, but there's a huge good water. So he wanted to have a bath in. His health advisors and OJ લોકો હોય Rajaved. Rajaved have advised that we don't take bath here, sir. Whoever take bath here, he becomes absolutely fever and convulsions and everything, and we don't have a medicine for that. But even though he was so rigid, Sikandar is Sikandar. So Sikandar have taken bath, and when he has taken bath, I'll tell you that he what he did was after next day he started getting fever. Not only fever, high fever with rigors and with convulsions and everything. All the Rajved have resigned because they know okay, if they try it, if they don't get the result, they will be killed. But there was one Rajved, one doctor like Modha. He wanted to cure him and he said that I will take challenge. And he has taken a challenge he has taken and the medicine he has prepared for him for his convulsions and fever and rigors and everything. And when he was taking that particular, but that Dr. Modha was not of that community from their own Rajved, and he was from the opposite community. But he was his companion only. So he got a messenger come and gave him a message that your opposition people wanted to kill you with the poison. So you just take care. And I got a photograph of it, and he was having that particular bowl in his hand. He wanted to drink it, whether he should take it or not to take it. If he don't take it, he is going to die with the convulsions and fever. If he take it, he might die, whatever the messenger says. But he take it, and from that day, the faith of the patient starts and begins. And he took it, and he became totally all right, totally out of the fever and faith. And that faith make him again back to the power and back to the fight. So from that day, the relations of the patients and the doctor is a faith and responsibility. Because somebody like Dr. Modha have to take responsibility. And then a patient have to have a faith. I know, as you have said, that સારું તો થઈ જશે ને સારું તો થઈ જશે ને પેશન્ટની બીક હોય જ છે, ડર કોને નથી હોતો. પણ એ ઓપરેશન ટેબલ ઉપર એ હાર્ડ ટેબલ ઉપર સૂવું અને ખબર છે કે પણ after anesthesia they don't know anything. We have got only prayers. That's why we pray.
Yes.
And
Yes.
that's only have saved Dr. Mr. Sikandar Alexander. Yeah. So
My
I think
goodness.
faith has to be there, and that increases our responsibility. You more the faith. મારે મોટા સાહેબ પાસે જ ઓપરેશન કરાવવું, મારે ક્યાંય કરાવવું નથી. મને મારી નાખે તો ભલે મારી નાખે, કાપી નાખે તો ભલે કાપી નાખે. So his responsibility increases. કે ચાલો આ તો મારા ઉપર આટલું વિશ્વાસ રાખીને આવ્યો તો હવે મારે સાજો કરીને જ છૂટકો છે.
Yes, yes.
અને એવા માણસો સાજા થઈ જાય છે. They do recover. Those who come with a great faith, they do well. That is definitely, I agree with Dr. D.K.Shah. અને ઓલું કે ને હજી રોતો આવે અથવા શોપિંગમાં જાય એવું what happened, you know, one store to Dr. D.K.Shah, then he will go to another orthopedic surgeon, then third orthopedic surgeon, then fourth, and they'll end up in always complication. Those who shop a lot, એટલે ઓલું ખબર છે ને હોશિયાર કાગડો ઢોહાના ઢગલા ઉપર જઈને બેસે એના જેવી આ વાત છે. એટલે જ હું હંમેશા કહું છું ભાઈ એક જ ડોક્ટરમાં ફેથ રાખો, તમારું ભલું જ થશે. ડોક્ટર કોઈ તમારું કોઈ ડોક્ટર બુરું કરવા ઈચ્છતો જ ના હોય. અને એટલે ફેથ ઇઝ વેરી ઇમ્પોર્ટન્ટ. અને સારી આશા એમ થાય કે હસતો જાય તારા સમાચાર લઈ આવે અને રોતો જાય મુવાના સમાચાર લઈ આવે. This is the story. And I do totally agree with Dr. D.K.Shah.
સો ટ્રુ. આજનો શો છે ને બહુ જ આમ શું કહેવાય, શીખવા ઘણું બધું મળે છે કે આમ
આ તો
સાયકોલોજીકલ
એક
ટ્રીટમેન્ટ થઈ
જિંદગી
ગઈ.
જાગતું legend છે. Dr. D.K.Shah
Yeah,
is a legend.
the
યસ.
knowledge is one thing. I'll tell you, the knowledge comes from the experience. We study there, of course. We study as Dr. Modha have studied in Mumbai. I am trained in Mumbai, but that they have trained technically, yes, lot. But the experience you get it from the practice. You get a day-to-day practice. Day to day, every patient is our teacher. I'll tell you, every patient
Yeah.
is our teacher. What I do, I'll tell you, Dr. Modha, when I go into my consulting, there are 15 or 20 patients waiting. I just make the like this and go inside the consulting. Then one patient have asked me, why do you do like this? I said that you are my andata. You are, if you are there, I am there. If you are not there, I am not there. So I have to pray that you are there.
Absolutely right.
Absolutely so true, sir. This
અને
is
હવે દર્દી ડોક્ટરનો ભગવાન છે. દર્દી તમને પૈસા દે, દર્દીમાંથી તમે શીખો અને દર્દી તમારું સાજું થાય. તો
That's right.
this is the
Some is not
reality.
true. That's true. Every patient teaches us some or the other lesson. Every patient.
so true. Amazing, amazing show. Next question આપણે લઈએ, which is about, પણ આ સ્ટોરી તો મને લાઈફ ટાઈમ યાદ રહેશે ફોર શ્યોર. તો થેન્ક યુ ફોર ધ સ્ટોરી, વેરી અમેઝિંગ. કદાચ મારું કંઈ થશે ને હવે તો આઈ વિલ રિમેમ્બર દેટ સ્ટોરી, નથિંગ એલ્સ, નથિંગ. તો નેક્સ્ટ ક્વેશ્ચન લઈએ, which is UV light can destroy all transmittable and other viruses. Should installation of UV equipment be mandatory for all medical clinics, especially surgical units?
This is to me.
Yes, yes, of course.
Okay.
All questions
Always.
go to you.
All question goes to you only.
I'll tell you one thing. See, UV is very good. It kills almost all the viruses and all the bacteria. But UV is dangerous for human beings also. So if UV lights are there in front of me, I may get blind. If I see to the UV light for about more than 2 minutes, my eyes may get absolutely
Damage.
blind. So what happens is, what one should do is, there are UV machines which are available, which has to be kept in operation theater or in consulting rooms or in the offices where there are people are sitting. They are continuously revolving the air purifiers, and there are UV tubes inside it, and Philips and other companies are manufacturing those air purifier UV machines. I think this is the ideal way to make because they throw a clean air and they suck out the virus and infected air. So UV machine is very good. UV lights are very good. We keep it in operation theater also. I have got 4 UV tube lights, but we close it down the doors, and in between the two operations, suppose one operation is over and we are going to take another operations for about 10-15 minutes, we start the UV light so that the operation theater become a little more sterile than what it is. Fumigation is one thing which we use daily, but UV lights are very good, but it is dangerous for human being if it is directly exposed to. Even skin problem can start with the UV light. The eyes are very sensitive for your sclera. You have got a retina and everything. I think it should be carefully used under supervision of the expert people.
Thank you, Dr. Shah. So next question, I think this is very interesting question, my favorite question, which is, as a senior orthopedic surgeon and chairman of ethics committee in Government Medical College, role of this post in COVID-19 management. Tell our listeners કે હાઉ વોઝ ધીસ રિસ્પોન્સિબિલિટી? અને જેમ આપણે વાત કરતા હતા કે રિસ્પોન્સિબિલિટી ઇટસેલ્ફ બહુ મોટું છે, રાઈટ? ઇટ્સ બિગ, હ્યુજ. હું એમ કીવર્ડ તો નહીં કહું, પણ ઇટ્સ અ બિગ થિંગ. બધાનું પોસિબલ નથી કે બધા આ મેનેજ કરી શકે. પણ તમે આટલો એક્સપિરિયન્સ ઓલરેડી છે તમને, તો તમને આ COVID-19નું મેનેજમેન્ટ, એનો એક્સપિરિયન્સ કેવો રહ્યો તમારો, અને વોટ ડુ યુ હેવ ટુ સે અબાઉટ ધીસ?
Well, one thing I'll tell you is about the ethics committee. What is the role of ethics committee? Ethics committee decides that whatever drugs are given are ethically all right, are ethically proved. What is ethically proved? In our committee, there are about 7 or 8%. Being a chairman of the ethics committee, dean is a member secretary. The dean of the medical college is a member secretary. The other head of the departments are members. There is one advocate, one social worker, and there's 3 other people who are looking after us, that we suppose they use this particular drug, is going to harm it or it's going to give anything, it is going to give results or not. And after that approval, we have a huge responsibility to approve the drug, and then it go to ICMR, at Indian Council of Medical Research. And they say that when the ethics, because our ethics committee is approved by the central government, so when our ethics committee have approved it, it is less chance that they disapprove it, unless otherwise there is a huge defects. So that is one thing. In between, there was a people of Ayurvedic people have come to us, to ethical committee, that we wanted to introduce this particular drugs for corona. But see, unless we have got a fixed data, we don't have a proof to see that how many patients were treated with this drug. In spite of the huge personalities come to even minister level, central government minister level was involved in it, but we
Oh my
cannot
God.
give approval without we cannot give a try on the patient. Patients are not a Huse animals that we can give a trial that by chalo apne try કરી જોઈએ. That drugs might be harmful to them also. Even it is Ayurvedic, I know it might be good. It might be good, but ethically it is our responsibility. If something goes wrong, there is a say that if something goes wrong, it goes on going wrong and wrong and wrong and wrong. There's Murphy's law.
Cascading effect. Yeah,
Murphy's law.
cascading
Yeah,
effect.
Murphy's law. Something like that. So we have to take care that even in spite of the Ayurvedic medicine or homeopathic medicine or other pathies, other than allopathy, we cannot have a trial on the patients. We have to have a proof on the animals, but not on the human beings. So ethics committee have got a huge role, number one. Number two, that we have got a huge control on the postgraduate students and the undergraduate students and the residents. These are the working, these are the people who work. આ બધા છે ને સેના છે અમારી. અમે સરદાર તો નામ અમારું છે ખાલી, બાકી સેના કામ બધું સેના. બોર્ડર ઉપર ફાઇટ કોણ કરે છે? બધા સૈનિકો ફાઇટ કરે છે. સેના મોઢા સાહેબ છે એ સુપરવાઇઝ કરે છે બધું, પણ ફાઇટ એની સેના કરતી હોય. મોઢા સાહેબ કે કઈક મોટા મોટા નિર્ણય લેવાના હોય તો મોઢા સાહેબે લેવાના હોય. કામ કરવાનું, 24 કલાક ત્યાં ત્યાં રહેવાનું, કોની ડ્યુટી આવશે, કોણ આવશે, બધું એ લોકો અંદરો અંદર એડજસ્ટ કરીને ફાઇટ કરતા હોય. એ લોકોને મોટિવેટ કરવાના. ધેટ ઇઝ અવર જોબ. મોટિવેટ કેવી રીતે કરી શકાય? કે વી વોન્ટેડ ટુ સે ધેટ વી હેવ બીન હિપોક્રેટિક ઓથ છે અમારી બિફોર વી બીકમ MBBS. હિપોક્રેટિક ઓથમાં એવું લખ્યું છે કે કોઈ પણ માણસને બચાવવું એ અમારો ધર્મ છે. સી અધર પ્રોફેશન અને મેડિકલ પ્રોફેશન ત્યાં ફરક પડે છે. માની લો કોઈ એન્જિનિયર હોય કે કોઈ ડોક્ટર હોય તો ફરક ક્યાં પડે કે આ હિપોક્રેટિક ઓથ અમે લીધી હોય અને અમે સાઇન કરી હોય અને ત્યાર પછી અમને રજીસ્ટ્રેશન મળે. એટલે હિપોક્રેટિક ઓથમાં એમ કીધું છે કે એક માણસે બીજા માણસને બચાવવાનું એ તમારો ધર્મ છે ને એ ધર્મ તમારે ચૂકવાનો નહીં. પૈસા મળે કે ન મળે, પૈસા ઇઝ સેકન્ડરી, but you have to save the life of the person. Same thing we teach the juniors, our students, that now you have to work it, and this is one thing, this is a challenge for you. I know this is not a very simple thing, but one has to work for this disease, and we have to fight it out. and that is how we motivate the students. We used to call them by virtual also. We have so many virtual meetings on the this
Zoom.
laptops and all, and
Mm.
we used to motivate them that what they have to do, what not have to do. They have to take care. They have to wear PPE kits. We used to get them PPE kits by through the some of the social some clubs and all, Lions Club and Rotary Club and all these clubs, so that
Mm-hmm.
they can get easily in the government hospital,
Mm-hmm.
because government hospital didn't have enough financial background to have, because this was a crisis. આજે 10 માણસ તમારા ઘરે આવવાના હોય જમવા, એને બદલે 25 માણસ આવી જાય જમવા, તો કેવી ક્રાઇસિસ ઊભી થઈ. ઓહો, આપણે 10 માણસનું જ જમવાનું બનાવ્યું છે. ઓક્સિજનની ક્રાઇસિસ એમાં જ ઊભી થઈ. ઓક્સિજન આપણી પાસે નહોતો, because see, we have never expected કે આટલું બધું એક સાથે પેશન્ટો આવશે ને આટલા બધા ઓક્સિજન લેવલ જોશે. એટલે there we have we have to work out certain ways, that we have to see who is more serious, more required, વધારે કોને જરૂર છે, વધારે ઓછો કોને જરૂર છે, એવી રીતે
Yes.
કરીને બહુ એડજસ્ટમેન્ટ કરવી પડે. Here there the exam starts. The real
Yes.
examination is not the examination in this
In the
thing, in
bed.
the examination hall. It is in
Yeah.
the operation theater and in
Operation
the
theater.
ward. Yeah.
Yes. Yes. Dr. Modha, how was the oxygen experience in second wave of COVID?
Oh, I will tell you my real, my nerves were actually out of control. See, in our hospital, we had a 20 minutes oxygen left.
Oh.
If we don't get the oxygen from the oxygen suppliers, lots of patients could have died. But fortunately, we received oxygen in 5 minutes time, and thanks to our administrator, and nothing happened to our patient, and all have done well. So it's oxygen is a really lifeline that we realize that day, that how oxygen is very important, and that's why we are getting oxygen plant in our hospital. That's the reason that we should not suffer and we should not depend on others. So these are the situation. We felt it very bad. તમે એક hospital, I will not name here, they
Huh.
lost the oxygen for 10 minutes and there were 3-4 patients died. Do you know that?
I remember
So,
that, and
yeah,
I also know that people were crying for the beds. Beds were not
yeah,
available, oxygen was not available, and people were literally, it was a crisis, I will tell that.
havoc,
It was a
havoc. It was a havoc.
havoc and chaos, yeah. Because,
આપણે કે
see, આજે
બેડ્સ નથી
તમને
તો
એક
કે
જ
સાહેબ
વાત
અમે બેડ લઈ આવીએ. DK, the situation was this, you feel laughing also and you can't help them out. They don't understand. આપણે કે વેન્ટિલેટર નથી તો કે સાહેબ વેન્ટિલેટર મારી ગાડીમાં પડ્યું છે. I tell you, આપણે
અને આમાં
કે
તો
ખાટલો નથી
આમાં
તો ખાટલો આમાં એવું નતું
ડોક્ટરને બ્લેમ
આવતું.
કરે.
એટલે
Yes.
જેને કે ઓક્સિજન અમે કીધું ભાઈ અમારે આટલાને પૂરો થયો ઓક્સિજન નથી તો કે ઓક્સિજન મારી ગાડીમાં પડ્યા છે 2 સિલિન્ડર છે સાહેબ તમે કેમ એમ કરીએ તો મેં કીધું ભાઈ વી આર નોટ પ્લગ્સ we have no plugs to fit your ventilator where can you fit so but
એ તો ઓલા
fortunately
લોબીમાં
you
રાખ્યા હતા ને.
રાખ્યા હતા લોબીમાં પણ સાહેબ અરે
One doctor who was, I know, I remember Dr. Modha's hospital, one doctor said that I don't want to go from here. So in the lobby, they have made a bed, and on the bench, he was just lying down. And you
yeah
have to give a treatment. You can't refuse it.
see when patient says I don't want to go you can't do anything. So it's a very miserable situation. ઘણા માણસોને ખોટું લાગી ગયું કે સાહેબ ફોન નથી ઉપાડતા કે સાહેબ અમને કઈ જવાબ નથી દેતા અમે આવ્યા તો તમારી હોસ્પિટલમાં ખાટલા નથી આટલા વર્ષોના સંબંધ તમારે ખાટલા તો દેવો જોઈએ ને but we were helpless really I feel pity that I'm saying sorry to all my people who has come and we are not able to solve them. I feel really sorry. I feel upset with me that I'm not able to help them out, and I feel I am having a pinch in my heart. So this is the really situation, very tough situation, and ભગવાન કોઈને આવો સમય ન આપે એવી આપણે પ્રાર્થના કરીએ. It's very difficult time, very difficult time.
Right. So આપણે last question લઈએ, which is again for Dr. D.K. Shah. How do you see as orthopedic complications after COVID-19, especially at mental and at emotional changes જે દેખાય છે, right, after post-COVID? So can you tell us something about that?
Very good question. Now I'll tell you two things. That young people, normally we don't see a avascular necrosis. That is known as some arthritis of the hip. In normally we used to see in about 1001 case, which is now after COVID, the person, if we take the history of the patient, that he had a history of COVID, and after that he start getting hip pain, we always get MRI done, and we found out that there is an early avascular necrosis. There is a less of blood supply because all the vessels of body are get blocked because of the clotting mechanism which is disturbed by the this coronavirus. It was the main important thing where you give a blood thinner after the COVID infection for a longer time, blood thinner. My daughter had COVID and she was admitted in SIMS Hospital, Ahmedabad. She is in Ahmedabad. And the
Uh-huh.
blood thinner has to be still after 3 months, she is taking a blood thinner so that otherwise, what happened that post COVID complications are more worst. It can block the periphery, it can cause gangrene of the foot, gangrene of the toes, gangrene of the fingers, with totally blackening of the fingers, and we have to just got with relief with amputation. Amputation is removal of that part because this particular clot may go and block in the brain, in the heart, in the lungs, in the periphery, and especially in the head of the femur, especially in orthopedics, I'll tell you that certain times this avascular necrosis was very uncommon when we used to have a routine practice prior to this COVID. And nowadays it is common, and at the age of 40 to remove that head and put an artificial implants there, because the implants itself the life of the implants is about 20 to 25 years maximum. That's the best implants available in US, Johnson and Johnson and all the good companies. But that life also is not more than 25 years. Suppose a year of 40 years of age, we put it there.
Yes.
So 65 years, after 65 years, it has
65
to be
what?
revived.
Yeah.
So it is very difficult situation for any surgeon. Otherwise, we don't have a treatment for that other than removal of the head and put a implant, total hip replacement. So that was one thing. This common complication is clotting mechanism is totally disturbed. Now, second complication is psychological. See, the people are having depression. They don't like to do work. They don't like to eat anything. They lost their appetite. They are not interested in of living. There are so many suicides has been taken place after the corona, post COVID. People are so much because of a lack of work and lack of health and weakness and taking breathing problem, and they don't have a stamina to work for anything. Suppose they were working prior to corona, they were working very well, they were working very hard, they cannot work after the corona, so they psychologically get depressed, and there they are detached from the family. Family people also get disturbed. I think that the role of the psychiatrist is there, where depression, antidepressant drugs, they get a sleepless nights, they get sudden jerks in the night, and they get wake up, and they say that they feel scared of the death, and these are the things
Yes.
which are very common. And I think that has to be treated by counseling, by medical treatment, by psychiatrists mainly. And we still have to give certain mental peace tablets to the people having a back pain. Suppose this is a very common problem which come to us day to day with the back pain and with the head pain and back pain in the trapezius and यहाँ दुखे ત્યાં दुखे fibromyalgia, and this is psychotic. So we have to add one tablet which give them a more sleep. It's giving cooling effect on the brain, and that will give keep a lot of solutions to the problem. But even though there are problems, the problems are going to increase in the future. I think the clotting problem is a worst problem, and the second worst problem is a psychological problem. Psychologically disturbance are very much, they are detached from the family, they are
Yes.
depressed, they don't get sleep, they are suddenly getting up from the bed.
Mm-hmm.
The answer
Mm-hmm.
to this problem is to
Yes.
have a lot of yoga and exercise, breathing
Right.
exercises, yoga, and I think yoga is the answer to this problem because it concentrates the mind, and there is a concentration of mind. It increases the blood supply to the mind, and
Mm-hmm.
that's how you can get more. And breathing exercise, of course. I think
Mm.
Mota wants to add anything to
Yes,
this.
No,
Dr.
no, no,
Modha.
absolutely right, sir.
And,
But I have seen few more things. As you mentioned about the heavy and avascular necrosis of head of the femur, but
Mm-hmm.
similar thing I have observed in the brain. Patient do develop stroke. They come with hemiparesis. Patient develop hemorrhage in the brain if they are taking anticoagulant for a long time. And I have seen young patients who get a heart attack after COVID. One of my relatives died at the age of 47. He had a myocardial infarction severe. He could not revive from the bathroom. And he had a just mild COVID before 1 month. So this is the complication we have seen. We have seen gangrene of the leg, we have seen gangrene of the foot, and lots of many things. But in brain and heart, all are very dangerous complications that sometimes they take life of the patient.
So true. I think there should be for the new students and the upcoming even like patient, there should be like a COVID chapter in the book that how to overcome. You know, that way they already are trained enough. Mentally, they are like they know how to deal with it. And mental health, વધારે જરૂરી મને લાગે છે going forward with the new
okay,
generation
one thing
also
I'll
and
tell you,
patients.
the last
Yes.
advice which I'm going to give is, see, these are going to be there in future also, not COVID. Suppose there was a swine flu when I was a faculty dean. We
Uh-huh.
used to give talk in the colleges, classrooms, how to
Mm-hmm.
prevent swine flu. Swine flu is another virus which was there
Yes.
about 6 to 10 years back. Then this virus have come, and we should not be surprised if we get new virus after few years. So we have to get the acquainted to preventive measures, how to prevent it. Always take a boiled water. Don't take even if it is RO water. Take boiled water. Take Wear the mask. Keep your hand washing with the sanitizer or any soap. Keep your social distances. Don't overcrowd the area. Don't if a person is having little more sneezing and more this thing, keep away from him or her. And I think that preventive measures are very important because in future also any epidemic or anything have is likely to come because the weathers there's a massive international and changes of weathers are going on. So I think we should be prepared for any type of crisis. And I think our government, especially in India, I think they have been very nice. As Dr. Mota has said, that they have also put up one oxygen plant. So like that, I think so many oxygen plants are put up in India, especially in Gujarat, and we are prepared to fight if anything comes, and we should be alert. And as soon as it comes, we should not neglect it.
All right. Thank you, Dr. Modha, and thank you,
Yes, sir.
Dr. Shah. This was really, really great conversation and great show. And I want to thank both of you for having a very lively show. So thank you once again. અને
Pleasure, pleasure,
અને તમારે કોઈ
pleasure.
કોમેન્ટ્સ હોય તો ક્લોઝિંગ કોમેન્ટ્સ ડોક્ટર મોઢા અને બાકી કાલે કોણ
Ah,
આવે છે એ તમે કહો.
yeah. I am very happy with Dr. D.K.Shah that he has elaborated his wide experience of ethical committee and uh, the situation we faced during the COVID time. It was really very hard, and actually, it's all a teamwork. To fight the disease is a teamwork. You cannot do alone. And what advice Dr. D.K.Shah has given, wearing mask, keeping social distance, wash your hands. These are the basic things which one should not forget even COVID goes away. Because this is the thing which will prevent you to get another infection. So be ready, whether COVID is there or not, but you can prevent yourself from the other infection also by taking simple measures. And with these remarks, with this, I will vandan Dr. D.K. Shah for his excellent comments and his thanks for coming to our show. And we can call him again. Dr. D.K.
Absolutely.
Shah is a lawyer also, you know.
No, he never mentioned that in his profile.
Yeah, he is our medical legal advisor of IMA of Rajkot. Whenever
Amazing.
something goes wrong, we quote all of Dr. D.K. Shah and he is requesting that please guide us. And he always stand by us whenever we are in trouble and he helps a lot. So this is
I,
another.
I Dr. Modha says I did law also, LLB also, after finishing my MS ortho when I was practicing. So I felt that why should we go to the lawyer? Why can't we be the lawyer, the best lawyer ourselves? Then I did law, and Modha and all team is so nice that they have asked me to chair the medical legal problem, any medical legal problem, because we are exposed to so many medical legal problems. Any patient have a right to uh, put up the notice or this thing, but we are very careful in spite of our total care. Their expectations are more. We know our responsibilities, but we thank you very much for this particular seminar, Dr. Prakash Moda and Ishita. Thank you very much.
Thank you so
Thank
much,
you,
sir.
sir. Thank
Thank
you.
you.
We are very happy. We
Okay.
will call you again.
Yes, yes.
Okay.
Sure, sure,
Thank you.
sure. You are most welcome. Oh, yeah.
Okay.
Bye-bye.
Okay.
Thank you. ડોક્ટર મોઢા કાલે કોણ આવે છે એ
Yeah.
તમે જણાવી દો પછી
Tomorrow,
આપણે.
Dr. Kirit Shukla was supposed to come,
હા.
but he has refused. Now he's going to Maua at his farm, and there is no internet connection. That is what he said. So that I
ઓકે.
will talk sometime later. But tomorrow, Dr. Nishant Chotai,
ઓકે.
he is coming, and I'm sending his number. You must be
યસ યસ
having
આઈ
it.
હેવ ઇટ
He
આઈ
was
હેવ ઇટ
he
આઈ
was
હેવ
for Monday, so but he will be coming on Friday.
ફ્રાઈડે એબ્સોલ્યુટલી ટ્રુ.
So please be in touch with Dr. Nishant Chotai, and we will have a show tomorrow, and then Saturday, Sunday off. Monday again, we'll find out someone. Okay.
ઓલ રાઈટ. થેન્ક યુ ડોક્ટર મોઢા. તો
Okay.
કાલે પ્લીઝ
Thank you.
બધા જોઈન થઈ જાજો. આજે સોરી અમને લેટ થયો, અમારે ટેકનિકલ ડિફિકલ્ટી હતી, બટ પ્લીઝ જોઈન અસ tomorrow at the same time 7 p.m. India time, 6:30 a.m. California time. Bye.
Okay. Bye.